Hey everybody, do you or someone you know have pelvic pain or issues with incontinence or prolapse? So here I am, Becky Oster-Blanton, talking to you about pelvic pain and prolapse today. Most folks don't want to discuss this. You're not going to see a lot of information out there yet about it. I think people think it's embarrassing. Pelvic pain, incontinence, and prolapse. And the reason I want to discuss this with you today is twofold. You see, one, pelvic pain sometimes gets misdiagnosed as back pain because you get pain in your pelvis in the back. And you go to somebody and you're like, oh, it kind of hurts right here. So they treat it, and it's not, the actual cause of the pain isn't getting addressed. So the pelvic pain doesn't necessarily go away. And two, because incontinence and those kind of pelvic issues have a 90% improvement rate when you look at the literature. The ability to make people better with problems such as pelvic pain, incontinence, and pelvic organ prolapse is very, very high. So why not treat it, right? It's like people are going to come into you with this problem, and I'm almost positive that if you fall into the categories that I treat, where you don't have an active cancer or you don't have a surgical issue, that I can get you better. So, and the other thing that I personally really like is that people are really happy. They want to get better. They want this treatment. They're fun to work with because it's important. It's happened to me. And after I had my daughter, I had some problems at age 29. And let me tell you what, man, when somebody said, oh, this is what's going on with you, you're having problems with urinary incontinence. And, I was wearing a diaper to work. I was 29 years old and, so I wanted to go to PT. I wanted to get better. So I was a good patient. I did my home exercise program. I did what they told me. And I have absolutely no problem with that right now. So this is why we're talking about this today, because this stuff works. This is one thing where physical therapy absolutely works. It works with fecal and urinary incontinence as well as chronic recurrent prolapse. You can see a marked improvement with this kind of treatment. So I want to share this with people because it worked for me and it's worked for several of my patients in the past. So pelvic floor physical therapy. It's good for men, women, and even kids. You see this a lot. You see incontinence a lot in young children, and physical therapy works well for them. Leakage, pain, and prolapse is caused by weak muscles or discoordination of muscles. So there is some that's, caused by cancer or caused by radiation, caused by structural issues or surgical issues. But largely when we see incontinence or prolapse, it's from weakness, and we can fix this. Unlike other muscles in the body, the pelvic floor muscles are parallel to the floor. So that makes their job even harder. Your organs actually sit on your pelvic floor. So it's more important that they're strong. What they actually do, they support the bladder and the vagina in women and the rectum. They maintain the position of the bladder neck for compression. So like when you to pick something up, the reason you don't leak is because your pelvic floor muscles hold on to the neck of that bladder and keep the fluid inside of you, for instance. So if you don't have that strength or that coordination or that ability to do that, you're going to have a problem with some leakage. So they also maintain the anal-rectal angle. So I don't need to tell you what that helps you with. So it keeps you not going to the bathroom until you have a chance to go to the bathroom. So you can see how having weak pelvic floor can cause problems, right? Anyway, the pelvic floor can even help you out with sexual function, back support, and breathing. So there's this theory with the core. It's kind of like your diaphragm up top, your pelvic floor in the middle. No, your pelvic floor on the bottom. And then the middle would be your transverse abdominis, your abdominal muscles and everything. We call it the soda can theory. So it looks like this. So you have on the right side, right here, you have an intact soda can. And that's because your diaphragm up top, your core muscles, and your pelvic floor muscles here, they're all strong and doing what they're supposed to do. So you've tried to squeeze a soda can, right? When you do it, or a seltzer bottle, when you squeeze them, they're tight, right? As long as they haven't been opened and there's no holes in them, you can't crush that bottle, you can't crush that can. Well, you have a weak pelvic floor and you go to crush that soda can, you poke a hole in it, you open the top a little bit or whatever, you get that. And what happens with that? Fluid leaks out. So you have weak pelvic floor muscles, improper breathing, and a weak core, and now you have a crumpled can, and you have problems with leaking, you have problems with prolapse, you have problems with pain. So that's what we're here to do, is make sure that you have a strong, intact bottle or soda can. You won't leak, you won't have any problems. So I keep saying prolapse, 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 and I should probably tell you what a prolapse is, because not everybody knows off the top of their head. A prolapse is when basically the large intestine slips out of the anus, or the anal walls or the vaginal walls slip out of the vagina. You can have a uterine prolapse, or your uterus, or a bladder prolapse, where organs actually fall down out of place from where they are. And that can come from weak muscles, from straining. It's common after childbirth or a trauma that can weaken the pelvic floor. For instance, if you have some kind of cancer or you have some kind of surgery and they cut you or they give you radiation, that's trauma to those muscles, and that can cause weakness, and that can cause these problems. Another thing that we can treat that I just want to touch on is generally a postpartum or post-childbirth issue that you see in women, but not always, is a rectus diastasis. So when you see a guy with big abs or a woman with big abs and she flexes her abs and she gets that line down the middle, in some people there's a tear in there, and it's really common when you're pregnant. And men can get it sometimes too, because they lift heavy things or whatever. So that's another thing that, if it doesn't get too bad, physical therapy can help. And a rectus diastasis can hurt. It can cause back problems. And that too can cause incontinence, can cause weakness, it can cause pelvic floor dysfunction, because remember, we talked about the soda can. So a physical therapist can help you with that as well. So far we're talking about strengthening the pelvic floor muscles, strengthening or correcting a rectus diastasis in the abdominal muscles and the lower back muscles. The other thing you want to think about, and that we'll look for, is proper breathing. Some people get these because of the soda can if they don't breathe properly. So we look at breathing patterns. I see that especially in little kids, and teach them how to breathe, or elderly folks. They're not creating the proper kind of pressure in their abdominal area, so they're having some issues with that. So that would be the top of the soda can, the diaphragm. So I want to give you just some information that you can do to help yourself and kind of experiment and see if this might be a right thing for you if you're thinking about it in the back of your head. There's some things you can do at home. The number one thing I have to tell you, if you're having these issues with incontinence, fecal or urinary, or prolapsing organs, go to the doctor and get checked out, because while the majority of cases are pelvic floor dysfunction or some kind of muscular dysfunction, sometimes they're not. And this one's a little different. It's not as cut and dry as some of the other videos I've done. This stuff, you want to get it checked out. You want to make sure it's not a prostate issue if you're a man. You want to make sure that you don't have bladder problems if you're a man or a woman. So you want to make sure that you're treating the pelvic floor musculature, and that's the appropriate thing to do, or your core, or your posture. Because some things are a little more serious with these problems. So you just want to make sure that you know exactly what you're dealing with. Or say you end up in my office first. I'm going to treat you for a couple of visits, 4 or 6, and if we don't see improvement, we're going to refer you back out to your doctor and say, let's just get this checked and make sure we're barking up the right tree here. You don't want anybody to have problems that are bigger than what you think you're dealing with. The next thing you can do at home is start doing Kegel exercises. So this is not the only factor in reducing symptoms of incontinence or prolapse or pelvic pain, but they certainly can help. One easy way to test if you know how to do it is, while you're urinating, you stop the stream of urine. That's a Kegel. Now, I'm going to tell you, only do that 1 time or 2 times. That's not the exercise while you're urinating. When you're urinating, you want to continue to do so and empty your bladder. You don't want to stop. What you'll train your bladder to do is to not empty all the way, and then you have a whole nother problem. So you want to just test it out and say, okay, I'm urinating, I've stopped. That's what it feels like. That's a Kegel. And then when you're watching TV, or you're sitting at a red light, or you're reading a book or something, you can do that same motion, and you hold it for 5 seconds, and then you want to take a 10-second rest and do that 5 times. And remember, the rest is just as important as the actual exercise. You won't hear me say rest very often, but when it comes to pelvic floor muscles, you want to make sure that you're resting. So that's the Kegel exercises. And another thing you want to do that's kind of easy to check yourself at home is make sure you're sitting properly. So when I sit down, if I sit on my hands, I've got 2 pointy bones in the bottom of my butt. You hear them referred to as the sit bones. You want to make sure you're sitting on those. A lot of people sit on their sacrum, or on that flat kind of bone between their hip bones. They're really slouchy. When you sit that way, you actually alter how the organs sit on your pelvic floor, and you can stretch out your pelvic floor, you can make it weak, you change the anorectal angle, the urethral angle, and you can increase the instances of incontinence. Also pelvic pain, because you're not sitting on your pelvis properly, so it's not bearing weight the way it's made to bear weight. And so with those three things there, you can be creating some pain, some prolapse, or some incontinence for yourself just by the way you sit. So get your hands under your butt and make sure that you feel those two pointy bones and make sure you're sitting on them. That way you know that your pelvis is oriented properly and that you're sitting at least with your pelvis in your proper posture. The last most awesome, best thing you can do if you're having pelvic pain, incontinence issues, or prolapse is come see me at Active Health. If you want more information on this, click the link below. We're doing actually a workshop on pelvic dysfunction and pelvic issues. Or you can email. It's Becky@physicaltherapymaine.com or Steve@physicaltherapymaine.com. Some of you might be a little more comfortable talking to a man or versus a woman. That's totally fine. We understand. And you can request a free meeting with us about this. We can tell you a little bit more about it. Maybe if you need a referral to a physician, we have some that we work pretty closely with. We can direct you to them. Or you can just come to the workshop. The other thing we're doing is we're going to do a free report. It's going to be the top 10 things you didn't know about pelvic floor physical therapy. It's about pelvic floor dysfunction. So if you email one of us, Becky or Steve, at physicaltherapymaine.com, we will actually send it to you when it's all done. So you can take a look at that as well. People come in here and they have no idea what pelvic floor physical therapy is. So it's going to be not only touch on some of the issues that you'll deal with here and how to help them, but also a little bit about what we do in here, because it seems pretty intimidating to a lot of people. So either way is cool. Send us an email, Becky or Steve, at physicaltherapymaine.com, your choice. You can click the link, register for the workshop. You can hit our Facebook page, you can message us, you can send us an email through our website. We're trying to be super accessible. We want to help as many people as possible. We'll answer questions. We'll talk to you, have a conversation, get you as much information, point you in the direction of a physician if you need it, or tell you about the different treatment options we have. Remember, you're not alone. I had this problem at 29 years old. I've been totally good for 12 years. Yes, I'm 41. So I'm not quite a youngster doing this, so we want to help you out, want to make you feel comfortable and answer your questions. So if you have any other things that aren't personal, feel free to comment below, and otherwise I look forward to seeing you or meeting you or talking to you. Our phone number here is 207-878-5002. Everybody have a great day, and I look forward to chatting with you all. All right, take care. Bye-bye. Thank you.